Imagine this. A young woman in her early 20s, let's call her Maya, starts noticing subtle changes in her body. At first, they seem insignificant, just small things that she can easily ignore. Her periods become irregular, appearing every few months instead of like clockwork. This irregularity starts to worry her, as she had always been regular before. She finds it harder to manage her weight, with extra pounds clinging stubbornly despite her usual healthy habits. No matter how much she exercises or how carefully she eats, the scale refuses to budge. Maya brushes it off initially, attributing it to stress or a busy lifestyle. She tells herself that it's just a phase and things will get back to normal soon. Little does she know these seemingly minor inconveniences could be the first whispers of a common yet often silent disorder, Polycystic Ovary Syndrome. It's a condition that can sneak up on you, often without any dramatic symptoms. Maya's experience is not unique. Many women go through similar struggles, often without realizing the underlying cause. Millions of women worldwide grapple with Polycystic Ovary Syndrome, often unaware of the underlying cause of their struggles. It's a global issue that affects women from all walks of life. This common hormonal disorder can manifest in various ways, impacting not just physical health but also emotional well-being and quality of life. The symptoms can be diverse and sometimes confusing. Understanding Polycystic Ovary Syndrome, its causes, and available management strategies is crucial for women of all ages. Knowledge is the first step towards taking control of your health. Knowledge empowers us to take control of our health, seek timely medical advice, and embrace a proactive approach to managing this condition. With the right information, we can make informed decisions. This essay aims to shed light on Polycystic Ovary Syndrome, providing you with the information and encouragement you need to navigate this journey with confidence and optimism. Together, we can face this challenge head-on and improve our quality of life. Polycystic Ovarian Disease, also known as Polycystic Ovary Syndrome in some regions, is a hormonal disorder affecting women of reproductive age. It is characterized by an imbalance of hormones, leading to irregular periods, difficulty conceiving, and other symptoms. While the exact cause of polycystic ovarian disease remains unclear, it is believed to be a combination of genetic predisposition and lifestyle factors. Women with polycystic ovarian disease often have multiple small cysts on their ovaries, although this is not a prerequisite for diagnosis. These cysts are actually follicles containing immature eggs that fail to develop and release during ovulation. This disruption in ovulation is the root cause of many polycystic ovarian disease symptoms. It can lead to irregular menstrual cycles, where periods may be infrequent, absent, or unpredictable. Difficulty conceiving, since irregular ovulation makes it challenging to get pregnant. Excess androgen production, resulting in acne, hirsutism, and male pattern baldness. And weight gain and difficulty losing weight, as insulin resistance, common in polycystic ovarian disease, can lead to weight gain and make it difficult to shed those extra pounds. Recognizing these symptoms is crucial for early diagnosis and effective management of polycystic ovarian disease. While the exact cause of polycystic ovary syndrome remains a medical mystery, researchers believe it's a complex interplay of genetic predisposition and environmental factors. This means that both inherited traits and external influences contribute to the development of this condition. This means that while you might be genetically predisposed to polycystic ovary syndrome, lifestyle factors can trigger or exacerbate the condition. For instance, maintaining a healthy diet and regular exercise can play a significant role in managing symptoms. Genetics play a role, with family history being a significant factor. If your mother or sister has polycystic ovary syndrome, your chances of developing it are higher, indicating a strong genetic link. Women with a mother or sister with polycystic ovary syndrome are at a higher risk of developing the condition, suggesting a strong genetic component. This familial connection underscores the importance of understanding your family medical history. Researchers are also investigating specific gene mutations that might be linked to polycystic ovary syndrome, although more research is needed in this area. Identifying these genetic markers could lead to better diagnostic tools and treatments in the future. Lifestyle factors include insulin resistance, where many women with polycystic ovary syndrome have insulin resistance, a condition where the body's cells don't respond properly to insulin, the hormone that regulates blood sugar. This resistance can lead to higher insulin levels, which may contribute to weight gain and other symptoms. This can lead to weight gain and excess androgen production. Excess androgens can cause symptoms like hirsutism, acne, and irregular menstrual cycles. Chronic low-grade inflammation is also linked to polycystic ovary syndrome, with factors like poor diet, lack of exercise, and stress contributing to inflammation. This inflammation can exacerbate symptoms and complicate management of the condition. Some studies suggest that exposure to certain environmental toxins, such as BPA found in some plastics, could play a role in polycystic ovary syndrome development. These toxins may disrupt endocrine function, further complicating the hormonal imbalances seen in polycystic ovary syndrome. It's crucial to understand that polycystic ovary syndrome is not your fault. The condition is influenced by a variety of factors beyond your control. It's not caused by something you did or didn't do. Blaming yourself is not productive and can hinder your ability to manage the condition effectively. However, by understanding the potential contributing factors, you can make informed choices to manage your symptoms and improve your overall health. Adopting a healthy lifestyle, seeking medical advice, and staying informed can empower you to take control of your well-being. Sarah, a 28-year-old marketing professional, had always struggled with her weight. She often felt frustrated and disheartened by her inability to shed the extra pounds despite her best efforts. Despite trying various diets and exercise regimes, the scale wouldn't budge. She tried everything from low-carb diets to high-intensity interval training, but nothing seemed to work. When her periods became irregular, she finally decided to consult her doctor. She knew something was off and wanted to get to the bottom of it. After a thorough examination and some blood tests, Sarah was diagnosed with Polycystic Ovary Syndrome. The diagnosis was a mix of relief and concern. At least she had an answer, but what next? Initially, Sarah felt overwhelmed and discouraged. The thought of managing a chronic condition was daunting. However, her doctor reassured her that polycystic ovary syndrome is a manageable condition, and with the right approach, she could regain control of her health. This gave Sarah a glimmer of hope. Sarah's doctor recommended a multi-pronged approach, dietary changes. She was advised to switch to a balanced, whole food diet, focusing on fruits, vegetables, lean protein, and healthy fats. This meant more home-cooked meals and less takeout. She was also advised to limit processed foods, sugary drinks, and unhealthy fats. Regular exercise. Sarah incorporated at least 30 minutes of moderate-intensity exercise most days of the week. She found that consistency was key. She found activities she enjoyed, such as brisk walking, dancing, and swimming. These activities not only helped her stay fit, but also lifted her spirits. Stress management. Sarah learned stress reduction techniques like yoga, meditation, and deep breathing exercises. These practices helped her stay calm and focused. She also made a conscious effort to prioritize self-care and get enough sleep. Adequate rest became a non-negotiable part of her routine. Within a few months, Sarah started noticing positive changes. Her skin cleared up, her mood improved, and she felt more energetic. Her periods became more regular, she had more energy, and she even started losing weight. The small victories kept her motivated. She learned to manage her stress effectively, which also had a positive impact on her overall well-being. She felt more in control of her life. Sarah's story highlights the importance of a holistic approach to managing polycystic ovary syndrome. It's not just about one aspect, but a combination of lifestyle changes. By making sustainable lifestyle changes, she was able to manage her symptoms effectively and improve her overall health and quality of life. Sarah's journey is a testament to the power of perseverance and a balanced approach. The terms polycystic ovarian disease and polycystic ovary syndrome are often used interchangeably, causing confusion. While they share many similarities, there are subtle differences between the two. Polycystic ovarian disease focuses on the presence of multiple cysts on the ovaries. Primarily diagnosed through an ultrasound scan showing the presence of cysts, may or may not present with other hormonal imbalances. Polycystic ovary syndrome encompasses a wider range of hormonal imbalances, including excess androgens and irregular periods. Diagnosis requires at least two of the following three criteria: irregular periods, signs of excess androgens, acne, hirsutism, and polycystic ovaries on ultrasound. Considered a more complex metabolic disorder with potential long-term health implications. In essence, polycystic ovarian disease can be considered a subset of polycystic ovary syndrome. All women diagnosed with polycystic ovarian disease meet the criteria for polycystic ovary syndrome, but not all women with polycystic ovary syndrome have multiple cysts on their ovaries. Understanding the distinction between polycystic ovarian disease and polycystic ovary syndrome is crucial for accurate diagnosis and appropriate treatment. If you have been diagnosed with either condition, it's important to have an open and honest conversation with your doctor to fully understand your diagnosis and the best course of action for you. Early diagnosis of polycystic ovary syndrome is crucial for preventing long-term complications and improving overall health outcomes. If you experience any of the common symptoms of polycystic ovary syndrome, such as irregular periods, acne, hirsutism, or difficulty conceiving, it's essential to consult your doctor promptly. Diagnosing polycystic ovary syndrome typically involves a combination of medical history. Your doctor will ask about your menstrual cycle, weight history, and any other symptoms you're experiencing. Physical exam. This may include a pelvic exam to check for any abnormalities in your reproductive organs. Ultrasound scan. An ultrasound can detect the presence of cysts on your ovaries, a characteristic feature of polycystic ovary syndrome. Blood tests. Your doctor may order blood tests to check your hormone levels, including androgens, insulin, and thyroid hormones. While there's no cure for polycystic ovary syndrome, early diagnosis and effective management can help regulate your menstrual cycle, improve fertility, reduce your risk of long-term complications, and enhance your overall quality of life. While medical management of polycystic ovary syndrome often involves medications to regulate hormones and address specific symptoms, there are numerous natural approaches you can incorporate into your lifestyle to manage the condition effectively. These natural strategies focus on addressing the root causes of polycystic ovary syndrome and promoting overall well-being. Medical management of polycystic ovary syndrome. Various medical treatments available for managing polycystic ovary syndrome. This includes hormonal treatments, medications to manage symptoms, and other medical interventions. Consult with your healthcare provider to determine the best course of action for your specific condition.